Good day. My name is Jill Braden Balderas, a contributing editor to the USC Center for Health Journalism. Thanks for joining our webinar. We're trying something a little different today by discussing how our 2021 Data Fellowship can bolster your reporting toolkit. You'll hear about how a more sophisticated approach to data can turbocharge your health reporting and how the Data Fellowship can give you the skills to get to that next level. We'll address what it means to interview the data as if it were a human source. That includes how to find the original sources of information and how to analyze that information, which taken together can lead to the kinds of high impact journalism we all aspire to. This all happens through a program that provides a week of training, reporting stipends, and 5 months of intensive one-on-one mentoring. Our speakers today will walk you through how to craft your application for this fellowship and to pitch your project. Before I introduce our panelists, a word about our format today. We'll be hearing from our speakers first, and then we'll turn it over to our audience for questions. Because we have many people joining us on Zoom, we will utilize the Q&A panel instead of the chat. So please type your questions into the Q&A panel. You can also write us there if you are experiencing technical problems. So on to our introductions. MaryJo Webster has been the data editor for the Minneapolis Star Tribune since 2015. She started her career as a reporter at small daily papers in Minnesota and Wisconsin before attending the University of Missouri-Columbia to specialize in investigative reporting and data journalism. While earning her master's degree, she also worked for the Investigative Reporters and Editors. Since graduating in 2001, she has worked at the Center for Public Integrity, USA Today, the St. Paul Pioneer Press, and Digital First Media. She is a regular speaker at journalism conferences and previously taught as an adjunct at the University of Minnesota. After MaryJo gives us an overview of our fellowship, you'll also hear from 2 2020 Data Fellows. Lex Ray is a contributor to the LA Taco, which is a James Beard award-winning daily news publication focused on street-level reporting, and Rebecca Lindstrom, an investigative reporter for The Reveal, a weekly investigative program on 11 Alive, the NBC affiliate in Atlanta. I actually grew up watching 11 Alive. MaryJo, so can you start us off by telling us why understanding how to find and analyze data is a critical skill for journalists to learn?
Thank you, Jill. It's so great to see everybody here. Data has become such a crucial piece of what we do as journalists because everything is stored in a database today. Even all the tweets that you're sending out and all the Facebook posts, those are stored in a database. But think about the government agencies and what information they have about our healthcare providers, our foster homes for kids, all these, any place, anything, the police. I could just keep going and going. All the crucial information that they have is stored in a database. And if we really want to ask some good questions about what's happening in those organizations or what's happening in society, we need to be able to interview data. Data is very much like a source, just like a human source, and we need to think about it that way. The trick is that talking to data is kind of like a foreign language. It's something you need to learn along the way. And this fellowship is a really, really great opportunity to learn how to do that. So as Jill said, there's going to be a week-long training at the end of October. This includes hands-on training in Excel. Last year, we also offered a track in the programming language called R because we had so many applicants who were ready for something more sophisticated. So we will decide that after we see who are selected for the fellows and what skills they need. So there will be lots of hands-on training, but then there's also sessions on, last year we did a session on how to build your own database, how to find stories, how to, we had some really good kind of inspiring sessions from people who've done really great work. And so it's a really great week of training. It will be on Zoom again this year, but don't fear, it's not as draining as you might expect. And then we're doing monthly virtual meetings after that, and those include more training opportunities during those months, and also times to collectively chat with other fellows and hear about what others are doing, and be able to see that you guys are all together in this. And it's a great networking opportunity as well. And the big thing that I think this fellowship does that is super important is that we don't just send you home after that training and say, go do a story. We provide you with mentoring from a senior fellow like me for 5 months after that session. And that is the crucial thing, because we can help you get a story off the ground. And you'll hear from Lex and Rebecca about how they got their stories off the ground. And that's the most important thing, is putting those skills into use right away. There's stipends to help with your costs, and then a requirement to publish 3 stories by the deadline, which is about 6 months out. The crew of people that will be teaching and mentoring you is really phenomenal. We typically have 4 senior fellows. We're still working on a new one for this year, but for sure it'll be myself and Christian McDonald, who is a professor at the University of Texas, Austin. He has a long career in data journalism, lots of great experience to share. Andrew Bautran is a data journalist at the Washington Post. If you see really great analysis from the Post, there's a pretty good chance his name is on it. And then there's other trainers that we bring in for the Excel training, or training in like Tableau, or other tools, how to use census data. There's a variety of things. We bring in other experts like Paul Overberg from the Wall Street Journal, Cheryl Phillips, a night chair at Stanford, Megan Hoyer, who's the head of the data team at the Washington Post. She used to head up the AP's data team. There's a long list of people who are really fabulous. You're getting the best of the best at this program. This is the Center for Health Journalism, but you'll find that the topics are pretty broad. Health is you can think of it very broadly. It's not just healthcare. Here's a few of the headlines from some of this year's the 2020 fellows. You can see that there's a wide range of things there, and some really great stories that came out of it this past year. So I want to focus a bit on what makes a good application. We want you to be successful and come in with a really great ideas. So these are the 4 points I'm going to hit here in more detail, but the 4, or I guess it's 5 big things kind of that I want you to keep in mind is: the story meets one of the priority areas. I'll talk about that in a sec. A compelling story idea, that is just a given, right, in journalism. So I don't fear that that will be a problem. The potential for community impact, and that the story will benefit from data analysis or would be impossible without it. I'll talk more about that. And that you've identified suitable and accessible data. I'll talk more about that as well. So the priority areas, we'll get you a link to this slide deck as well. On the website, there are priority areas there's one set of a list for anyone applying for the national fellowships, and then those applying for the California fellowship. So if you're based in California, you're looking at the California fellowships most likely, unless you're doing a national story. But there's all kinds of things around inequities and, for example, one of my fellows last year looked at housing, unstable housing in LA. And so it's not just writing about like hospitals or things like that. So take a look at this list and just make sure you have something that falls in one of those buckets. It's a pretty long list of stuff though. Community impact. So, a good story is going to be one that identifies a problem, including who or what agency is responsible, and has the potential to result in some sort of change. A law change, maybe sending someone to prison, I don't know. But getting the system to work better for whatever it is you're writing about is something really important. So you should be thinking about ideas that look at, how is the system supposed to work compared to how it actually works? Or did they do what they said they would do? And Lex is going to talk about that in his project. That was a kind of a key driver of his project. Those are 2 of the big questions, but there can be many others. But you want to think about a story that would identify that there is a problem and why this is a problem. So data is the harder part. I realize that many of you are coming in here probably with maybe minimal data skills or maybe no data skills, and that's totally fine. And we're asking you to pitch a data-driven story idea. And that's the tricky thing about this application. But as a journalist, you should already be having an idea of what questions you have. And it's a matter of figuring out, okay, this is a question that maybe only the data can answer. Maybe a human cannot answer the patterns or trends, or maybe there's no report out there that has already identified this. Those are the kinds of stories that are really good for a data-driven story. So for example, one of my fellows like I said, looked at housing, and his question was, what was going on with violations for a general term would be unfit housing, things that violated city standards for housing, like someone was living in a garage that wasn't really supposed to be a housing unit or something like that. And he, wanted to know how prevalent these violations were, and if there were certain neighborhoods that were hit harder with violations than others, and what was happening during the pandemic. And these are all questions that, let's say you go to a government official and they may give you a vague answer, or they may have no answer, or they may try to sugarcoat it. Or you might not get the details you want, and you also won't get the specific locations. For example, in this story, it was like the data could give him specific locations where there were problems. And you're not going to necessarily get that from a human source. And so the data has details. But think of that data as a source that you're going to interview, and you're going to ask it questions. And so you want to start thinking about questions that these are common ones in journalism. Has something gotten worse or better over time? Is something worse or better in one location compared to another? How much money has been spent on X versus Y versus Z? How often has something happened? These are all things that data are really good at answering. And if you frame your proposal, so like my fellow, the housing one, if he had simply phrased it as hey, what's going on with unfit housing in LA? That's not going to take you anywhere. But if you frame it with, are there more violations for unfit housing now than there were 10 years ago? That gives you something that data can answer, like a hard and fast question. So let's talk a little bit about the data and what I mean by data. So I often hear editors tell reporters, hey, add some data to this story. And often what they mean is go grab a big number and drop it in. And that is not data in the sense of what we're going to teach you at this fellowship. This, for example, these are summary numbers. This is some old data from flu numbers from Minnesota. These are big numbers that somebody else has already compiled. It's not actually data, it's numbers. It's a result of somebody else's analysis. And you want to look for something that gives you a chance to ask questions. So here's influenza hospitalizations, a little more detailed. Now we know by county and by season, going back over time, how many hospitalizations there were. And so we can ask questions like, which county saw the biggest increase over time? Which county has had the highest average across all these years? What does that statewide number look like over time? Which county was the worst in the most recent season? Those are all questions we can ask the source that maybe we wouldn't get from a human source. But this is still what is considered summary data. Anoka County there back in 08-09, there were 13 people hospitalized. We know nothing about those 13 people. We don't know if they were male or female, young or old, whether they lived or died. That's the kind of detail that is missing from this because it is summary. With a topic like healthcare in particular, or some of these more sensitive topics, we do run across privacy issues where this might be the best data we can get. And that's okay. It's still data, it's still useful. We can still ask questions, but your goal would be to see if you can get as low of a detailed level as you possibly can, because then you can ask more questions. So here's that housing data that my fellow used. Each row is a violation, and you're not even seeing all the fields of information here, by the way, and this is just a few records. His database was millions of records. But each row is a violation at a particular housing unit somewhere in the city on a particular date. And so any housing unit could be in here multiple times, but this is as detailed as the data gets on this in the city's inspections department. And the more detail you have, the more questions you can ask. You know, how many fire safety violations were there? How many missing or defective insect screening? How many were there last year versus this year? How many in this neighborhood versus that neighborhood? Which building had or address had the most violations? The more fields of information and you have, the more detailed it is, the more questions you can ask. And you can think of that as a more knowledgeable source. Like, when you go find human sources, right, your goal is to find the person who knows the most. They have the most depth of knowledge, the historical knowledge, they've got a lot of experience, they're connected to a lot of people. It's the same thing with data. That's what you're looking for. So one of the things that will help with your application is if you try to identify that suitable and accessible data now, before you submit your application, so that you can tell us, hey, this is the data I'm planning to use, and yes, I can get it, and yes, it does have the information that I want. And so if you could do a little prep work here in the beginning, you'll have a much better application. So you can, it's really just being a reporter, getting out there. There's no magic trick to finding data. It's just like finding a human source. There's, a couple little things. You can look at methodology sections on reports. You'll find some data online, but don't assume that it's the only thing they have. You might find, private or nonprofit entities maybe have data, like a hospital might have, they certainly have data, but will they give it to you? Probably not, because they're not governed by public records laws. You also see researchers often get access to data, and maybe they've done a great, academic report, but sometimes they have special access that we may or may not be able to get. One of my fellows was able to get access to survey data, and she and I had to both sign a disclosure agreement that we promised, we wouldn't share the data, or we wouldn't publish it as is or anything like that, but that, we would follow some rules about how we used it. So sometimes you can, but that's something you need to chase down. But the main thing would be to try to find who has the data you want and ask for a meeting with their data person or people, and then ask them a bunch of questions. So I've got a bunch, and I'll try to roll through them here quickly. What fields of information will it include? Is there anything that maybe you can't have because it's private or non-public? You'd want to try to get what's called a record layout. And this is one that I just pulled out from my computer, and these are school test score data, but this is an example of a good record layout. It lists the fields of information that are in the data and what each one represents. And anybody maintaining a database should have something like this that would show you what's there and what's not. And then an important is the who, what, when, and where. What universe does this data cover? How many years back in time could I go? Like with the housing violations, Dave wanted to go back, I think he went like 10 years, 5 years, 10 years, something like that. And it really depends on your topic, but do they have 5 or 10 years? How current is the data? This is one thing we ran into a lot with last year's fellows. We got a lot of applicants that wanted to look at, something, what's happening because of COVID right now. And sometimes the data that they would need to answer that question is not available in real time. It might be something that's not available till the year following, like in this case, 2021, or maybe sometimes even 2 years following. Some of the big databases in this world are really slow, and it takes some time before you can get access to them. So it's important to know, can you get access to the stuff you really, really need, like in time for this fellowship? And then it just really, the other questions really depend on what the data is about. Is it, is it about hospitals? Well, which hospitals are included? Are they all the ones in Texas? Are they only the large hospitals, only the public hospitals? Think about all those possibilities of what could be in there or what might not be in there. And, flat out ask them, what does it not include? Is there something that is missing that I should be aware of? And is there anything that has changed over time that, let's say maybe right now it includes the private hospitals, but 10 years ago it didn't. That would be a change that would affect the quality of your data, for example. What does each record or row represent? Think about a spreadsheet with each row, and is it, like in the housing example, is it each violation? Is it each housing unit? If it was hospital discharge data, each patient, each time they showed up, maybe only one record per patient, regardless of how many times they were there. Like, it goes on and on. If there's something specific you want, ask that it's included. I had a colleague of mine ask for a database once of everybody in Minnesota who had lost their foster care license, either had it suspended or revoked. And in her request, she asked for the name and the date they were licensed, they got their license, and the date it was revoked, and the reason why it was revoked. And the agency kind of went up in arms like, oh my God, it's going to be so hard for us to get this to you. It's going to cost us so much money. It turns out that their database didn't include the reason. That information was kept in the paper records and it's not in the database. And it was, a really simple thing that if she had asked this question ahead of time, we wouldn't have had so many headaches. And like the agency was literally flipping out over her request, but it would have been great to just ask this question up front. How do they use the data, and how does it get created? Just understanding where the data comes from and how they use it is good. So here's the big one. Can you get it in a suitable format? So you want to try to avoid a PDF if possible. I've seen many instances where a reporter will request, hey, give me a list of X, and they will get a PDF. You need to ask, can I get it in a machine readable format? And you're going to learn more about this at the fellowship, but mainly the main ones would be, hey, can you put it in Excel for me? Will it even fit in Excel? If it can't fit in Excel, then they should be able to output the data as either a comma delimited text file or a tab delimited text file. And if you want more information about this, Google machine readable format or CSV format, and you'll get some good advice. Sometimes you will find things might only be in a PDF. Maybe it's reports from group homes or something like that. And that's just the only way they store it. But you want to make sure that this is not a machine readable format, is not an option before you go with a PDF. A good idea to find out if it's going to cost you any money, because that stipend, we'll make sure, if you get accepted, we'd make sure you have enough money to cover the cost of that. And then how quickly can you get it? One of my fellows, we started in December last year, and she just assumed, oh, I'll put the request in early January. They'll have me the data in like 3 weeks. No, it wasn't. It was more like 6 weeks, and she was delayed a bit on her project because of that. So just having some idea of like what the turnaround might be is good. You don't need to have the data actually in your hand when you apply, or even when the fellowship starts in October, but it would be good to have it by like the end of November. The fellowship's going to be the end of October, so you'd want to have it in your hand by the end of November for sure. So knowing that that's possible is important. But let's say that they can only give you PDFs. Well, maybe you could transfer all that records from the PDFs make your own database, or maybe you'd have to collect information from multiple places and combine it into one database. I've done that numerous times. we've had fellows conduct surveys and actually go out and build their own database, truly like ground level reporting. And that is an option as well, if that's something you're interested in. One other thing to think about is just where the data is at in difficulty level. You know, if we're talking millions and millions of records, or that the data is going to come in some strange format that is not suitable for what we're going to train you in, like Stata and SPSS are statistical database software. It is possible to convert them, but these are things to make sure you understand and that you have an idea of what you're getting with this data. The other thing is, like, let's say you want to do some kind of geographic trend analysis where you might need GIS software to do the analysis. We generally don't do GIS training. I ended up doing a little bit on the fly with my fellows because a couple of them needed it. But it isn't a huge part of the fellowship generally. We'd probably add it if there's a lot of people wanting to do something like that. But these are all things I just want you to think about and be aware of as you're figuring out what data you need. You know, this is reporting 101, you know, finding other news stories with the same topic, especially data-driven ones, maybe from other parts of the country or something like that. Maybe they're old. You know, look for academic research, you know, talk to a couple experts. This does not need to be huge, but doing a couple of these things are going to make for a stronger application in the long run. Okay, so I'm about ready to send it over to Lex here in a minute. You will be asked to meet with a senior fellow like me or Christian or Andrew via phone or video chat before submitting your application. And we can then, you know, all these things I just told you, if that was all over your head and you're like, I don't know what to do, we can talk specifics. You can, you know, tell me or Andrew or Christian what, you know, you're encountering, what you found when you know, asked all those questions, and we can help you sort that out and help you get a better application going. We are starting those meetings already, so just reach out to the center if you're ready to have that meeting. I think Rebecca is going to talk a little bit about this, but it's really important that you have your editor or producer buy in on this, that they understand the time commitment, that they understand the game plan and what these stories are going to be. And I'll let her talk a little bit more about that. And there's the deadline to apply. So I'm going to turn it over to Lex here, and then Rebecca, and then we'll open it up to Q&A after that.
Cool. And MaryJo, just so I know, how much time do I have roughly?
5-10 minutes.
Okay, cool. All right. Hey, everyone. My name is Lex. I am a LA Taco contributor, which is a daily news publication based here in Los Angeles, where I live. My story for the fellowship, it focused on portable sinks and toilets that were distributed to homeless encampments during the pandemic here in Los Angeles. I started reporting on these hygiene stations back when the pandemic first hit. I lost a lot of work at the time and was kind of just roaming around my neighborhood taking photos when I began to notice that these hand washing stations and porta potties were being rolled off of trucks and placed near encampments. Pretty quickly, I realized that many of those hand washing stations and toilets weren't being maintained for soap, water, and paper towels. So I did a story for a website called Curbed LA, a website that's since shut down. But for that story, I had no experience with data. And I actually, to report on the hand washing stations in my neighborhood, I actually walked around to every single hand washing station for like a week straight, walking like sometimes like 10 miles in a day to report on that story. But it had pretty big impact. It was cited in a pretty notable lawsuit here in Los Angeles. And about a week later, the mayor said during a COVID briefing that the city would maintain these hygiene stations and assess them every single day going forward, because back then they were only assessing them every week. So to talk about MaryJo's point of like why did I think that this story could create an impact? It was really because the city and the mayor, they were so adamant that these hand washing stations were being assessed every day. Months later in the summer, the mayor doubled down and said that again, that they were being assessed every single day. And by then it's really clear, you know, if you just went walking around, you would see hand washing stations that weren't. So identifying that and applying for the fellowship, I wrote 4 stories for LA Taco, and my key sort of findings were that the city failed to assess all these hand washing stations daily. They only assessed about half of them. And during the first 5 months of the pandemic, they actually assessed fewer as COVID cases were going up. Units went days, weeks, some cases more than a month without being serviced by vendors. And despite failing to assess these hygiene stations and to service them daily, the vendors still collected millions of dollars from the city as well as in federal loans. So how I got there was going through a lot of really messy data. The spreadsheets that I got. So after I wrote that first story, another journalist hit me up, and they had obtained these daily records of assessment records from the sanitation department that showed each hand washing station that they checked on and what the soap, water, and paper towel level was at each unit. So they sent me a bunch of those assessment records, but they were all like each day had a spreadsheet. So I had hundreds of spreadsheets at the end of that. And so I had to combine all them together, which was a pretty complicated process. It took me a long time to figure out. Then I had to figure out how many days went in between units being serviced. I mapped all the hand washing stations to figure out how many were in each council district. I obtained hundreds of contracts and purchase orders, as well as 311 data, just to figure out, to kind of guide my reporting and figure out which neighborhoods had like the most complaints about encampments and illegal dumping and stuff like that. So yeah, some stuff I learned, I would really emphasize, if you can get your data before you apply. I was lucky, I was fortunate that I had like a bunch of data before I even thought about applying, and was just kind of sitting around. I didn't have much experience with Excel and analyzing data. So when the opportunity presented itself, this was like the perfect opportunity to do something with that data. I'd also suggest requesting a meeting with a senior fellow beforehand. That helped me a lot. And just in terms of like requesting your data beforehand, like way in advance. For example, I requested some data from LA San in October of 2020. They didn't get back to me with the data until April 2021. And when they only gave me some of that data, and they estimated it would take an entire year to complete my request. So make sure you get those requests in early. Stuff that I wish I knew is just know that you're going to run into some hurdles. I had to deal with a lot of messy data. I know other people that worked with MaryJo, they also had to deal with some messy data. And you know, don't let that discourage you. It's pretty common. And you also might run into problems with departments getting back to you, or they might even stop talking to you like they did to me halfway through your reporting. But all that can make a better story. And then lastly, I'll just say that one thing that I wish I knew is that sometimes your shortest story can have the most impact. The last story I did, which was about how the city decided to remove all of the hygiene stations pretty abruptly, I would say that was the story that had the most impact. And it took the least amount of time to write, and it was the shortest story and kind of came out of nowhere, but it had a huge impact just because I think people really understood what was at stake and what was going on, just by, you know, looking at the headline or yeah, just reading that report really sent a strong message to people.
Fabulous. Thank you, Lex. You guys start queuing up your questions for Lex, and we're going to turn it over to Rebecca. I have your slide here. No, that's not what I wanted to do. Come on. There we go. Rebecca.
Woohoo. Yeah, so our project it got started around an incident of a mom who had abandoned her child at a hospital. And just this idea of abandoning your child seems so odd to me. Like, why would you do that? And in her defense, several other moms came forward to her court hearing when she was found and said, look, we've got a big problem in this state. And this, isn't the mom's fault, it's the system's fault. Well, I wanted to know really what was the fault of the system. And to get at that, I knew that, our children who are abandoned, they end up in our child welfare system. So I wanted to do a big data request from our child welfare system. And that's when this fellowship just really kind of came along. I learned about it and it was the perfect timing. Our open records requests with our child welfare system are very, very expensive. So I knew to get the kind of data that I was requesting was going to come with a pretty big price tag. I also knew that this wasn't going to be a one and done type story, that this was going to be something we were really going to have to peel back. And doing this type of fellowship really gave accountability to doing the stories that were going to be needed in order to cover all the things that in my head I had envisioned we would cover. And I hate to even put a number to the stories we will eventually do on this subject, because if my editor sees this later, she might have a heart attack. But when we did our presentation for the fellowship, we had a sense of the data we wanted. The data took a lot longer to get. Thankfully, I did get it within enough time to be able to meet all the deadlines associated with the fellowship, but it still took me longer to get. And I would, to MaryJo's point, if you know the data and you can actually access it or begin to access it now, that's really beneficial, because I found as we were learning some of these new tools during the training portion of the fellowship, had I had that data, I would have gone shortly after and just started applying it to my own records so that I could really reinforce the skills that we were learning, instead of finally getting the data and then scratching my head going, well, I know we learned something that related to that would be really helpful. What was that? And then having to figure it all over again. So either way, you could make it work with this fellowship, and certainly with your mentor. They're just there to help you and walk you through and make sure that you're able to extract out of the data, interview the data to the best of your and their ability, so that you can really get that story that you want. So either way, you can make it work. But if you're able to get that data up front, or at least part of it, then I do think that could be beneficial and really helpful to reinforcing the things that you're going to learn. I love data. I've worked with data for years, and still there was so much I was able to get out of this fellowship. And really, even after the training was over, just having these meetings with my mentor and saying, look, okay, I want to know this. And I know that the answer's here in the data, but I can't figure out how to get it out. And he was able to walk me through, or even take a little bit of his own time and try to play with it and see where he got. And then I would be able to follow his steps and learn what he did in order to be able to duplicate that for myself. And it was in working through that data with him that we realized just how many problems were actually in the data that I received. And I had asked for information on, it's child welfare, so they've got to de-identify all of the data. But I had asked for a unique code for each child, their age, the date that they came into the system, the date that they left the system, where they went when they exited care. And in all of these different points, I was able to figure out how many of them actually ended up exiting care because they went to juvenile detention. How many of them went to foster care? How many of them actually went back home to the parent who had abandoned them, or to some other family member? And then through that, one of the things that we realized, because all of a sudden we were like, wait a minute, do we have duplicate data? Oh, shoot. A lot of these kids were abandoned to the system more than once. So we had to go through that in kind of interviewing the data and realize that they weren't duplicate entries. They really were children. One child in 5 years was abandoned to the system 4 times, just by different entities that had tried to assist this child and get this child what they needed so that they could be successful and stable. So from there, after the data, really where my project has grown now is trying to look at those systemic gaps, the weaknesses that really do exist that are leading parents to just kind of throw up their hands and say, we have tried everything and we cannot find the programs we need in order to help this child be successful. And so we're doing stories on mental health parity, workforce shortages, step down services from the high-end type intensive care services to what are we doing in the home so that maybe these children never really have to leave. So I would just challenge you as you're thinking, does my project fit into this fellowship? I mean, meeting healthcare and all the different things that you can consider as a story subject, it's really broad. And as long as you can tailor it and show how you are benefiting the health of some entity, in this case, it was the health of these children who were being abandoned. A lot of times I think we kind of pigeonhole what we think healthcare reporting or health journalism is about. But it really, I mean, if you think about it, I mean, health is everything around us. It's from the air that we breathe to the water we drink, to the people we interact with, to the things that we think. So a lot of opportunities in order to use this fellowship to help out with whatever subject you're trying to do. She had asked us to think about something we wish we knew before we started the fellowship. And I would say, yes, as she mentioned, make sure that your editor is on board with what you are doing. I had a very, very supportive executive producer. But that said, we're in a time of COVID. We, throughout my fellowship, we had the election cycle. There was just a lot going on. I'm in Georgia, so we had an extended election cycle. And there were a lot of, from the monthly meetings to different blogs to training sessions to just getting the stories done. Make sure that you're really committed to wanting to see this through. There are a lot of deadlines. There are a lot of expectations. It's all very manageable, but this isn't, hey, I'm going to get some training. I'm going to get a little bit of help and then I get to check out. Like, you are going to need to be engaged all the way through the process. And there really is an expectation that you're going to turn these stories, because I mean, that's the goal, is to, help make the world a better place, for lack of a better phrase, but using this training and this funding in order to help us do it. So yes, making sure my editor is really on board, and then just realizing that when you get into this, your story is probably going to be a lot more than what you originally anticipated. My original plan, I think, had 3 stories in it, and okay, I'll just say it, I'm up to 10. So the more you get into it, whether they're short stories, like Lex talked about, or really long involved stories, the more you start peeling back your subject, the more stories you're probably going to find and want to tell.
So Rebecca, you could, when you heard about that mom who gave up her kid, you could have just gone and done that story about that one mom and that kid.
We did. And we
did
originally. And that's, like I work at a broadcast television station. So we did that story, and it just itched at me that story was incomplete, that there was so much more there to tell. And I'm actually super excited because I just last week got permission the family is now living in Ohio. They have been reunited of sorts. There's a joint custody situation, but I just got permission to travel to Ohio to interview the mom and the child, who were kind of like faces in surveillance video when we did our initial story. And then, just a woman at a court hearing. And we're now going to get to sit down and really hear her story and what she tried, and meet this child, so that they get to become people. So they get to be so much more than what that initial story had to offer and say about them.
Rebecca's stories are a really great example of one of the things I love to do in data journalism, which is to pair the heartbreaking human story with the data that allows you to show the systemic problem. The heartbreaking story, one person, whatever, is not going to show a systemic problem, never. You could have the best story on earth, it's never going to do it. The data story with just showing the systemic problem will fall flat because you don't have the human heartbreaking part. You put the two of them together, it's impossible for policymakers to ignore that. So it's a perfect example of putting those two things together. And I'm excited to see the remaining, 7 stories? All right, let's turn it to questions. Again, if you have a question, put it in the Q&A box, not the chat. There's a Q&A box on your Zoom. Put it in there, and I'll drop the link to the slide deck as well, because there's a bunch of links in here you might want. So let's see here. A question. I'm a healthcare researcher with data scientist and scientific writing background. This fellowship seems to be targeted for journalists. Would someone like me be able to work on it? Occasionally, I think we accept things like this if you're partnered with a news organization, but it would be an edge case scenario. So you should reach out and ask that, talk to someone at the center directly about that. I think this one's a question for Lex. I love your project. It's so great. As a freelancer and regular contributor, to various publications. I'm scratching my head as to how to get an editor to commit to publishing 3 stories well before they even know what the stories will be. How did you deal with that? Well, I'll start with, it's a good idea to figure out what those stories kind of will be, at least roughly. But Lex, advice on freelance pitching.
Yeah, I think that's a good point, MaryJo. You should have some idea of what those stories are going to be. In my case, I was already super committed to this story. As I mentioned, I did a story for Curbed LA, and then about a month after that, I obtained all this data. And during that time period, there's really nobody reporting on these hygiene stations. And I kept on it. I mean, I was like checking hand washing stations every time I saw them, eventually dozens and dozens of these stations. I was continuing to report on like my findings on Twitter and kept searching for answers. So I think my editor, I mean, they always have my back when I come to them with a story that I feel like really, really passionate about, especially if it's an exclusive. And I think my editor just recognized that I was really committed to this story. Nobody else was reporting on it, and I had obtained all this data that was really useful.
You should have some idea of your stories. One of the other questions is, must we submit story ideas for all 3 at the beginning, or can we pitch one story that has a lot of follow-ups and leads in it? You should try to think about 3 different aspects of your story. And sometimes what happens is if you could kind of envision one big story, and then you think about it in sections or chunks. And maybe one of those chunks ends up being its own story, for example, but you should try to pitch 3 different aspects. So for example, one of my other fellows, she wanted to write about crime victims in Chicago, shooting, people who survive shooting. And she ended up looking at data both from the police department on, who is being hurt in this gun violence, age and gender and race and things like that. But then she also looked at a program for crime victim compensation fund that the state has, and was able to use the data to show that, first of all, not all the money gets spent. Tons of people get denied, and it's a very little known program, not very well run, kind of a train wreck situation. And so, looking at who's the victims and how they're affected, and then looking at the money, for example, is a nice way to kind of chunk that off. But this is also something the conversation with the senior fellow could help you maybe identify in the beginning. And yes, you're probably going to pitch some story ideas that are a little more vague than what you would get later in the thing. Things sometimes do change. You find things in your data work, in your reporting, that send you in a slightly different direction. The Center for Health Journalism hopes that you're not going to change direction, but of course there's always room that we can make that happen, as long as it's not a really like abrupt, like let's change the topic entirely and go another direction. And this is kind of why it's good to have done a little pre-work. You know, like Lex said, he had written a couple stories on this topic already and kind of found some sources and had some inside information into it that helped inform his pitch for his ideas. Rebecca, I have a question for you. What was the timeline that you requested your DFCS data? You said it took a while.
Yeah, and I don't know if Jasmine's talking about the timeline from when I asked for it to when I got it, or the timeline of the data itself. I'll answer both. I believe that I asked for it in November and I received it in late January. Part of that delay was because they didn't actually keep the data like in a database that it could all just be filtered or sorted. They really did have to go back to some paper documents or merge several systems into one in order to respond to my request. As far as the time frame that I requested for my data, I asked for 5 years and received probably about 15, but I would say that the other 10 years didn't have enough integrity for me to really feel like I would use that. It seemed like maybe they found some stuff and so they wanted to go ahead and give it to me because it was there, but I did not, based off some other reports and things I had to kind of truth check the data, it didn't seem like it was complete. So I really maintained my focus to the core 5 years in our reporting that was about 2016 to present. I was also just going to piggyback on a question that Charles had about, and I think MaryJo, you spoke about this as well. How often do you come in with one thing and leave with something else? We did have someone in my group as part of the fellowship that happened to, but it wasn't that they changed their story. It's that the data told them the opposite of what they expected. And they reported the truth of what the data had to say when they, finally received it and were able to interview it. They thought that the consolidation of hospitals was going to lead to a lower quality care or infant death rate. And what they found was because of some other external factors that came into play, that actually it stayed the same, if not improved. So again, I mean, you can go in and we all have a hypothesis of what we think the data is going to tell us just based off of our experience with the subject. But I know that we're all after truth. So if you get the data and it leads you in a different direction than what you originally pitched, I mean, you're still doing the same subject. You just have learned something new. And that surprising element was kind of one of their stories. I think ended up being one of their key stories is to, well, yeah, we've seen it reduce care here, but it didn't here. And then here's why. So there's that flexibility in there.
Yeah. A question about the priority areas. If you go to the data fellowship page on the Center for Health Journalism and scroll down a ways, you will find lists here. So for the national applicants, racial, ethnic, and geographic health disparities that are emerging each day as the pandemic continues, the role of systemic racism in influencing child and family well-being, the role of policy in improving prospects for children, child illness, injury, and mortality trends. These things are really broad. And then there's the California list is even longer, but environmental health is here. That's a great topic right now. Issues around mental health and opioid use, also another big one. We're coming off the worst year of opioid deaths in history. Healthcare costs and healthcare financing. So lots of different areas here to look at. If you want, when you're ready to talk to a senior fellow, you should reach out to Sunny Alvarado at healthj@usc.edu. I'll put that in the chat as well before August 24th. Jill, do you have something to add? We're wrapping up.
Yes, well, I just wanted to thank everybody for participating, especially our wonderful panelists, and to you, MaryJo, for coordinating all of this and moderating. We will be sending everyone a survey afterwards asking for your feedback on the webinar. So we would greatly appreciate it if you take a moment to complete that. And we'll also be asking you for other ideas on topics of interest. And just a reminder, the deadline for applying for the 2021 Data Fellowship is September 1st. And also, we will be archiving this webinar on this same page where you registered for it. So if you'd like to watch it again, or if you would like to send it on to someone else who you think might find it of interest, that would be great. So again, thank you all for joining us, and we wish you a wonderful rest of your day.